Senator Bill Cassidy. Dr. Bill, how are you this morning?
Very good. How are y'all?
Well,
Good.
You are right in the middle of another Obamacare replacement hubbub. May I start? This is a pretty broad, it's not even a question, it's a statement. But it's the point about this whole argument, if you will, that has really been in my craw for some time. I'm going to say it, and then I want you to talk to me about it. The evil genius of Obamacare is that it runs a massive welfare program through private business, that is, the insurance companies. Am I wrong in saying that? And if it's true, how do we fix it?
Jonathan Gruber, the guy that supposedly is the architect of Obamacare, who called the American people too stupid to understand it, said on Bill O'Reilly once, it is a wealth distribution scheme. And it takes from the middle class and it gives it down. It takes away choice because the only way you can control costs is to limit choice. How do we fix it? We do what our bill does. We give the resources to the working families to let them buy their own insurance. We don't give the money to the insurance company. We give it to the family. We allow them to pick the policy that works best for them. That controls cost. It returns power to the patient.
Will this, in your mind, will your bill with Lindsey Graham, will it expand? Because we know with Obamacare, choice is decreasing, if not being eliminated. Will your bill, and how will your bill offer more choice?
It offers more choice because now the person can buy what works for them. Frankly, a 25-year-old man probably doesn't want very much choice. He just wants something in case he gets in a car wreck. That's all he wants because otherwise he's not healthy. On the other hand, you take a guy, my age and your age, we probably want a little bit more choice, mainly because my wife tells me we want more choice. And so it allows the person to pick the plan that works for them. And that's ultimately how markets work. You let the consumer pick that which works for them. If they got to pay a little bit more, they pay out of their pocket. If they want to pay a little less, well, they save some money, but they get something a little different.
I'm watching the Senate yesterday, and man, you got pummeled. 32 million people will lose coverage under your plan. You're going to kill babies and the elderly. No longer can I get coverage for pre-existing conditions. You're a dastardly man, Senator Cassidy.
Yeah, of course. I'm the only person in that Senate who has spent 25 years caring for the uninsured in a public hospital system. I'm the only person in there who, with my life's work, is dedicated to helping those who have not when it comes to health care. Now, what they're doing now is a talking point. Just because somebody they care about loses, their state, for example. Some states have such high costs, you cannot believe it. The whole federal government is supporting their state's budget with all this money, and they're trying to defend that. But they can't say, oh, listen, I'm watching out for my state's budget. They have to say, oh, my gosh, we're throwing people off insurance. It's not true. You can expect more of it. Bring it on.
The American Heart Association, the American Cancer Society, a whole list of these medical groups oppose your bill. What's their big issue, and can you get around that hurdle?
Because it limits the amount of money that can be spent on health care, period. Sooner or later, our taxpayers cannot afford to pay ever-increasing amounts. For example, we do spend less. We get rid of the penalties associated with the individual mandate and the employer mandate. We get rid of those taxes. Turns out 58% of the people who pay the penalty on the individual mandate earn less than $50,000 a year. We are taxing these working families and putting the money in the kitty, and they're mad we're taking the money out of the kitty. I can tell you, at some point, you got to live within your means. I'm saying that as a doctor, again, who worked in the public hospital system for 25 years. But you've got to live within your means, or else our whole country will go bankrupt, and just can't do that.
Dr. Bill, I saw an article last night that said you may have already, right now, today, as many as 49 votes for your bill. Can you get the last two?
I think we do, but we continue to work it. One thing, the people of Louisiana did not send me to Washington, D.C. to quit. They sent me to work, and try and find something that works for patients and works for the taxpayer and works for our country. And until the last vote, I'm going to continue to do that.
Let me ask you this. If you can boil it down, let's hone in on me or Robert. What is going to change for us? We have private coverage.
Nothing at all.
No costs going up? Premiums aren't going to go up?
Nope. This does not
deductibles aren't going to go up?
This does not touch your insurance. This is the individual market. It's the Medicaid expansion.
What about my pre-existing conditions that I may have? I got a law. I'm a kind of a, shaky ground.
One, it doesn't touch employer-sponsored insurance. So if you get it through your employer, you're untouched, number one. But number two, if you're through the individual market, our legislation specifically says that if a state wants to do something different, they got to make sure that those with pre-existing conditions have adequate and affordable coverage.
But how are those, pardon me, Dr. Bill, how are those costs in your case, in this case, in your bill, not being passed along to the average everyday insurance carrier or insurance holder?
So what we do right now, there's so much money out there. There's so much money out there, but it's just not being used well. So we give what is called a flexible block grant to the state. We take the money that the state would receive through Obamacare. Not all of it. We get rid of these penalties. We get rid of some of the taxes. But we give the money to the state. Now they can combine these dollars and use it more efficiently. We put it through the CHIP program, the Children's Health Insurance Program, which everybody loves. It was a little ironic. The other night, some senators railing against my plan. And at the end of it, he goes, but there's good news. The good news is we just reauthorized the CHIP program. We're putting our program through CHIP. So on the one hand, he criticizes us. On the other hand, he's praising the program we're putting it through.
Are you on a timetable to get your bill done by the end of the month when the new fiscal year starts?
Absolutely.
You optimistic today?
I'm neither optimistic nor pessimistic. I got a job to do, and I put my blinders on, and I work, and I work, and I work. If at the end it works, I've done my job. If for some reason someone decides they don't want to vote for, I think, a common sense solution, I've still done my job.